Productivity is going up in the hospital sector on average with about 3% a year. This was not the case in the late 1990s when it was more or less flat. So you could say that productivity has increased quite rapidly and now is about at the same level as the private sector. Why did this happen? I think, there are many reasons of course, but I think one of the main reasons was that we had reforms and that these reforms kind of opened all kind of new initiatives. You know, people had to think from one day to another, okay, we have a different health system now, so we should do things differently. And that really opened up lots of innovation, and most studies show that especially innovations on the organizational side of the healthcare delivery system, so for example new clinics, nurse practitioners, etc., that they really add to this increasing productivity. Well, two things. I think the funding was there to do new things, so they could experiment. And secondly, we asked them to deliver volume. So the system was highly targeted to volume over the last decade or so, and then it's basically volume has gone up quite tremendously actually. And so I think, it's the combination of that, opening new windows of opportunity, but make sure that there should be lots of volume. Well, then basically productivity is what you get if you measure it then after. So it's a thing like that, I think. Yeah. At the turn of the last century, Dutch people were among the oldest in the world in, say, the 1970s. Top three, top four, maybe something like that. Then it stagnated tremendously during the 80s and 1990s. And life expectancy actually was more or less average compared to other Western countries. And then it started to rise with about 3 months every year, which is rather a liability for pension funds because, well, that's so the money was everybody's getting older. But it does show, and there are some studies underlying that, it does show that all the additional investments in the healthcare sector has really risen life expectancy. So I would say that's what we say value for money. That's if you find it ethical to compare an additional year of life and monetize it, and then look at the investment, probably is huge. There's huge value for money. I think, from my perspective, the main lesson is that people should be stimulated to do new things. We know from studies that there is waste. We know that there is hardly any relation between the cost of care and the quality of care. So obviously you can have many best practice, but somehow they do not spread. So we know about best practice healthcare systems in the US or Spain, but mostly they're regional. Probably they're also here in the UK that one region is better than the other region, but it just doesn't spread. So the thing is, how do we spread best practices regarding value for money? And from my perspective, healthcare sector is rather conservative of getting more leverage into the system to do that. So for example, if you do a good job, you get 2% additional reimbursement. And if you do a bad job, probably everything stays the same. And I think we need the leverage that if you do a bad job, then you will be punished with, say, 20% less reimbursement. And if you do the good job, you will be reimbursed by an additional 20% of funding. And then you really get the leverage to spread up the change, which is already there. I mean, it's only local. That's the thing. Is it's a local. At some local level, it's perfect, but on other local levels, it's not that good. So we should spread the good local practice to a national level, and I think we need much more leverage into the funding to do that.